Valley fever, we've talked about, it's kind of a mysterious illness in
Yeah.
a way. I don't think we've got it totally figured out, but it is a big problem in Arizona, especially in the summer when we have those big dust storms.
Yeah, Desiree is live for us, learning more about valley fever, explaining a little bit of it to us. Hey, Des.
Hi. So you guys know that I'm relatively new to the Valley. I've never heard of valley fever. So really interesting what we're talking about this morning with Dr. Hatfield here at the Hatfield Medical Group. Thanks for being here with us this morning.
Thank you for having me.
Thanks. And for other folks that maybe are new to the Valley, can you just explain what valley fever is?
Yeah, you know, valley fever is endemic to Arizona, and there's approximately 10,000 cases a year. Believe it or not, most of those are located right here in our state of Arizona.
Okay. And what are some of how do we get it? And then what are some of the symptoms related to valley fever?
Great question. It's a fungal infection that is in the earth. It's a fungus, actually. And so when the monsoon seasons kind of kick up, the fungus grows from the moisture, and then the wind and the dust storms and the haboobs that we see here in the valley, right? All of that dust and all that stuff, you think, oh, it's just dust, I better protect myself. Well, there is valley fever that resides in all of that dust, and how you get it is you breathe it in. And some of the symptoms that we see are common with a lot of other symptoms that we see with other illnesses. So think fever, fatigue, respiratory symptoms like cough, and skin rashes.
Skin rashes. Okay, I thought that was an interesting symptom. But do you have to have all three of those symptoms, or could you just have a rash and no fever, or would it be a combination of them all?
Great question. No, you do not have to have all three. It can be one. And that's why it's so important that if you have one of those symptoms, that you're evaluated by your primary care provider. And there's tests that they can do to determine if it is indeed valley fever. So they can do a chest x-ray, because it's a respiratory illness. They can draw blood. And in some cases, we need to do a CT scan, which might show changes in the lungs that are consistent with that.
Okay. And can you talk about some of those changes in the lungs that you've seen in patients? And, you know, are the side effects, or will we suffer longer even after we've cured the fever if we have, like you said, the nodules in our lungs?
So because it's respiratory, right, most of the changes that we see are in the lungs. And you think of like symptoms like bronchitis, pneumonia. After the disease has after the fungus has resolved or the infection's resolved, we see lung nodules that stay in the lungs. Usually those don't cause any long-term problems. And we need to mention prevention. You know, there's not a really foolproof great way to prevent valley fever, but in Arizona we do need to be aware of a couple of the ways. We don't want to be just outside, out and about during these monsoon storms or during the haboobs when we see the dust coming. We want to head for indoors where we have filtered air. We all have these masks left. Well, we're not out of the woods yet, but with a resolving pandemic and more folks getting vaccinated, we have a lot of masks still lying around. It's appropriate to use those masks in a setting where if you work outdoors and you're in a place where a lot of dust or dirt is being kicked up, or during a monsoon and you have to be outdoors, certainly appropriate to wear a mask. And remember, the mask helps prevent getting the fungus. It's not an infection that we see that is contractable person to person.
Okay. So it does not spread. I can't catch it if you have it. You can't catch it if I have it.
That's correct.
All right. How do we cure it if we do get it?
So for the mild symptoms, it's usually just watchful waiting, and we monitor the patient to ensure, and we might treat things symptomatically. For a more moderate or advanced illness, there's oral medicines and even up to IV medicines that we would use to actually cure the infection.
Okay. Is there an age group most at risk here?
You know, it's obviously most folks, adults that are out and about in the community. We think of people that work outdoors, farmers, landscapers, people that manage golf courses, you know, just folks that are more outdoors are more susceptible to it.
Okay. All right. Well, it's good to know. Thank you for all that information. So you can prevent it by wearing a mask if you are outside around that dust, and then certainly just stay on top of it. If you have any of those symptoms, you'd make sure that you check in with your doctor. I'll send it back to you guys.
Does that freak you out a little bit, Des? You're new to the Valley. You're like, what's valley fever?
You know, when I saw valley fever on the memo this morning, I was like, what is that? What is it? Can I catch it? But no.
Oh, no big. It's a
He's
fungus
my nerves on that.
out of the ground that blows in the air. No big deal.
Valley fever
So
fungus.
interesting.
Welcome to Arizona.